Are you getting a few more facial hairs than you'd like? Maybe you've noticed some thicker, darker strands appearing where you least expect them, making you feel self-conscious or just plain frustrated. If you've ever found yourself wishing those pesky hairs would just disappear, you are absolutely not alone. Millions of women experience this, and it can feel like a secret struggle, but it doesn't have to be. Today, we're diving deep into why this is happening and, more importantly, exactly how to tackle it head-on. Don't miss out on understanding your body and reclaiming your confidence. I'm Dr. Sam Ellis, a board-certified dermatologist, and my goal is to help you understand your skin, hair, and nails so you can find solutions that truly work for you. If that sounds like the kind of helpful expert advice you're looking for, make sure to hit that thumbs up button and subscribe to my channel right now. We're about to uncover everything you need to know. Before we jump into treating and managing excess female facial hair, it's really crucial to understand what's causing it in the first place. You see, it's completely normal for women to have hair on their face, but usually this is the fine, light hair known as vellus hairs, often described as peach fuzz. This is quite different from the thicker, coarser hairs we typically see on men, which are called terminal hairs. How much peach fuzz you naturally grow on your face is largely decided by your genes. However, there's a condition called hirsutism where women develop thicker, darker hair on their face and body in a pattern that's more characteristic of male hair growth. This can mean noticing noticeable hair on the beard and mustache areas, as well as between the breasts and on the lower body. While this is a departure from typical female hair growth, it's more common in certain ethnic groups, like women with Mediterranean, South Asian, and Middle Eastern backgrounds, purely due to their genetic makeup. Beyond genetics, your age and menopausal status also play a role, but a significant factor in excess hair growth for many women is having too much androgen in the body. Androgens are male hormones, like testosterone, that contribute to classic male features, such as specific hair growth patterns or a deeper voice. One common condition where women experience androgen excess is polycystic ovarian syndrome, or PCOS. Women with PCOS often develop benign cysts on their ovaries, which can lead to an overproduction of these androgens. Excessive androgen formation can also be linked to other conditions like adrenal tumors, congenital adrenal hyperplasia, or Cushing's disease. Furthermore, as women go through menopause, they might notice increased facial hair growth, not because they're suddenly producing more androgens, but because their estrogen levels decrease, causing a shift in hormone balance that mimics a male-dominated pattern. It's really important to distinguish hirsutism from another condition called hypertrichosis. Unlike hirsutism, hypertrichosis involves excessive hair growth in areas of the body that aren't influenced by androgens, meaning you won't see that typical male pattern distribution. People with hypertrichosis often develop an increase in both peach fuzz and terminal hairs, especially on the face. Some individuals are born with congenital hypertrichosis, meaning they've had excess hair from birth. Think of the classic image of the wolf man. While rare, hypertrichosis can also alarmingly be a sign of an underlying cancer. So, if an older person suddenly experiences rapid growth of facial and body hair, this would be highly unusual and absolutely warrants a medical evaluation for potential cancers, including lung, breast, uterine, colorectal, bladder cancer, and lymphoma. We also can't overlook the impact of certain medications, as these can definitely trigger excess hair growth. This is vital to understand because when we look at solutions, we want to make sure no medication is making the problem worse. In my dermatology practice, common culprits include minoxidil. While topical minoxidil is used to promote hair growth on the scalp, it can sometimes transfer to the face and cause unwanted facial hair. Oral minoxidil, taken in pill form for hair growth, can also lead to unwanted hair elsewhere on the body. Another frequent cause is testosterone supplementation, which, while sometimes prescribed to women as part of hormone therapy, especially postmenopausally, can introduce new issues like acne or increased facial hair. If you are struggling with excess facial hair growth, my strongest recommendation is to consult with your primary care doctor or a dermatologist. Getting a proper diagnosis, whether it's hirsutism or hypertrichosis, is the essential first step before embarking on any treatment. Knowing the underlying cause allows for the most effective and targeted approach. For my female patients dealing with hirsutism caused by androgen excess, often due to PCOS or similar conditions, we have several effective strategies. One option is topical cream called eflornithine. This cream is typically applied twice daily to areas like the beard and mustache, working by thinning those thicker terminal hairs. It acts by inhibiting an enzyme crucial for hair growth, though it generally takes about 6 to 8 weeks to see results. Like most treatments, you need to keep using it to maintain the benefits. If you stop, the hair will likely return to its baseline. For those with androgen excess, especially due to PCOS, birth control pills can be incredibly helpful. Specifically, combined estrogen and progesterone pills can regulate and lower androgen levels produced by the ovaries and adrenal glands. Often, we combine birth control with a medication called spironolactone, which you might know as a treatment for hormonal acne. Spironolactone helps decrease testosterone production and helps your body clear excess testosterone. Again, oral treatments like birth control or spironolactone usually take 3 to 6 months to show results, and continuous use is necessary to maintain them, and sometimes simply losing weight can also help improve androgen excess. Now, beyond medications, there are many hands-on ways to remove the hair you currently have. First up, shaving. I know it might feel a bit unconventional for women, but if you have hair, you can absolutely shave it off safely and effectively. I even have other videos with tutorials if you're interested. Alternatives include chemical depilatory creams like Nair. You do need to be cautious with these on your face. Always patch test on a small area like your inner arm first to ensure you don't have an irritation. These creams typically use ingredients like thioglycolic acid, which dissolves the protein in your hair, so be careful not to apply them near areas where you want to keep hair, like your eyebrows. Other excellent temporary methods include threading, waxing, or sugaring. These are all perfectly fine if you have hirsutism and are looking for short-term solutions. And let's bust a common myth right now. No matter how you remove your hair, whether it's shaving, waxing, or even laser, it will not come back thicker or darker. If you're seeking a more permanent solution, then professional treatments like laser hair removal and electrolysis come into play. Electrolysis is a fantastic option where an electrical current is carefully delivered into each individual hair follicle, essentially destroying its ability to grow hair. Because it's done follicle by follicle, it's best suited for smaller, more targeted areas like the face. A huge advantage of electrolysis is that it works on any hair color: black, red, blonde, even white or gray hair. In contrast, laser hair removal or intense pulsed light (IPL) devices require the laser to see brown or black pigment in the hair to effectively target and destroy the follicle. So, while laser hair removal can be truly transformative for darker hair, it won't work on blonde, red, or white hair. Both electrolysis and laser hair removal can be uncomfortable, with electrolysis often being more intense, and both require multiple sessions to achieve noticeable improvements. It's also important to manage expectations with laser hair removal. It's not always 100% permanent. You might experience a significant reduction in hair or thinner hairs, but future hormonal shifts like pregnancy or menopause can sometimes bring some hair growth back, meaning maintenance sessions might be needed over time. While at-home IPL devices exist, they're generally not as powerful or effective as professional clinic treatments, though they can be an option if clinic treatments are not feasible for you. A crucial point to be aware of with laser hair removal is something called paradoxical hypertrichosis. This is a rare phenomenon where, after laser treatment, new and sometimes even more hair growth can appear. While uncommon, we do see this more often in certain ethnic groups, particularly those of Mediterranean and Middle Eastern descent. That's why it's absolutely vital to choose an experienced practitioner who understands this potential complication and can either help you avoid it or counsel you if you're at higher risk. From my clinical experience, the most successful outcomes for female patients struggling with excess hair growth rarely come from a single intervention. Instead, Studies and real-world results consistently show that a combined approach, perhaps a birth control pill, a topical cream, and regular laser hair removal, yields the very best and longest-lasting results. Do you have any favorite hair removal products or professional procedures that have made a real difference for your excess hair growth? Please share your experiences and insights in the comments below. Your input could help someone else who's feeling exactly how you used to. As always, thank you so much for being here. Don't forget to give this video a thumbs up if you found it helpful and subscribe to the channel so you don't miss our next video. I'll see you then.